Good morning, everyone. Welcome to Medicare Monday with Indiana SHIP. I'm Susan, and I am joined by my two co-hostesses, Megan Rogers, who's up there in Northern Indiana, and Melanie Garland. She's down there in Southwest Indiana. So we are so glad you joined us this morning for Ask the Expert. And I'm glad Melanie and Megan are with me because they're going to answer all your questions.
Megan, what were we thinking, letting her do the introduction like that?
I know, I should have taken the reins on that one.
I know, you can't trust me. Anyway, so we invite you to text us, chat in, however you want to communicate with us this morning and ask us any question you want about Medicare. And we have many years of experience between the three of us, but if there's something that we don't know, we will find out and report back. So feel free to ask us anything. And we're so glad you joined us. In case you don't know, and you've just happened on us in the internet land, SHIP is the State Health Insurance Assistance Program, and we are a federally funded program that helps people with Medicare questions. And here in Indiana, we're in the Department of Insurance, so we've got a lot of great information for you. So, gals, what do you want to add this morning?
Yes, that was great. Well, I think kind of before people start asking some questions and everything, we ladies, Megan, I'm going to put you on the spot here. Just a common question that you get a lot, just kind of a common counseling question that you receive.
Well, probably a common one is that I get, and I've been getting recently, is can you have Medicare with Medicaid? That's been coming up a lot recently for some reason. And the answer is yes. Now, there's one type of Medicaid that you cannot have with Medicare. It's called HIP, the Healthy Indiana Plan. And once you get your Medicare, your HIP goes bye-bye. So it's very important that individuals realize that and they get their Medicare set up, their drug coverage, their supplemental coverage, their A and their B. And we can also, as SHIP counselors, see if they would qualify for one of the other Medicaid programs that they would qualify for, either being traditional Medicaid or one of the Medicare savings programs, which helps people pay for their premiums and their copays and deductibles. And then we would help them get that switch from HIP Medicaid to either the traditional or the Medicare savings program.
Megan, I had Good Morning America on this morning, bright and early, and one of their lead stories was this whole thing around folks losing Medicaid and the public health emergency. Can you give us just a short ditty on that and how it may affect Medicare beneficiaries?
I sure can. So for those that don't know, during the public health emergency, the last 3 years, people on Medicaid were not having their Medicaid reviewed every year. And that's a requirement of Medicaid where you have a redetermination. Well, Medicaid wasn't allowed to kick anyone off during the public health emergency. So what is happening is now, starting April 1st of this year, Medicaid is going to start doing the redeterminations again. So if your income has gone over the guidelines for any of the Medicaid programs out there, then you may lose your Medicaid. Maybe you'll have to transition to a different Medicaid that has a higher income or asset resource level. So it's very important that you make sure right now that your updated current address, phone number, location is on file at Medicaid. So if you've moved in the last 3 years, you want to make sure you're calling Medicaid and making sure they have your updated information. So they'll be sending you letters. They're going to be doing this redetermination over the next 12 months. So what they're doing is, let's say your last redetermination was in August of 2019. Then your redetermination this year will be in August as well. So if you happen to remember the month of your last redetermination, that's when your next one will be. But it's very, very vital that you make sure your information is up to date with Medicaid, because if they can't contact you for the redetermination, if you don't answer your phone, you're just going to be cut off completely. So we don't want that to happen if you still qualify.
I just had somebody message us and they said, so if I have Medicare and Medicaid during the public health emergency, I've just been using my Medicaid for my drug coverage, but a friend told me that I need to be using Medicare. How do I go about getting Medicare drug coverage?
Call us. If you reach out to a SIP counselor, we can help you find a Medicare drug plan, either through a standalone Part D coverage or through an Advantage plan, to make sure that your drugs are covered through Medicare. So if you lose your Medicaid benefits or get changed to a different form of Medicaid, then you've got that drug coverage set up.
Perfect. So they need to enroll in a plan.
Yep.
To have that drug coverage. Perfect.
But I also tell people, try Medicaid first, because most drugs, I think all drugs, are free to the participant on Medicaid. But as we know, not all drugs are free when you're on a Medicare Part D plan. So I always say, try Medicaid, whether it's traditional Medicaid or the Healthy Indiana plan first. And then if that gets rejected, then you whip out your Part D Medicare card.
Yes, absolutely. Well, we've got a question from Sean here, guys. Susan, I'm going to pass this one to you. I was recently asked if a lift chair is covered by Medicare.
Oh,
that sounds like a durable medical equipment to me. I wonder how that is covered.
It is. Well, yes and no. So good morning, Sean. Thanks for the question. So here's the thing about lift chairs. Well, first of all, anything that Medicare pays for has to be medically required, medically necessary. So where some of us who don't have medical reasons to need help getting up from a sitting position, sometimes, heck, it would just be nice to have a lift chair that lifts you up and pops you out. But, I don't think my doctor would say it would be medically necessary for me to have a lift chair. So that's the first thing. The second thing is that Melanie is right. The mechanism that converts a recliner chair to a lift chair is what's covered under Medicare Part B, because it's a piece of durable medical equipment. So the whole chair is not covered by Medicare. You can't pick out your color of upholstery or whether you want leather or pleather or fabric. The chair you purchase yourself. It's the mechanism that lifts that chair that's covered. And we know that Part B expenses, whether it's durable medical equipment or outpatient surgery, is covered by Medicare at 80%. And then you pay 20%. Or if you have insurance that picks that up, they will pay that too. So your chair is not going to be free.
But there is a coverage. Okay. Yes.
Or the lifting mechanism.
Yes. That always tricked me as well when we were first learning about that. So
sometimes those commercials on TV or in the magazines, anybody reads magazines, I know I still do, there's quite a few advertisements and they indicate that the insurance will pay for the whole thing, and that's not true. They're just trying to get you to call and buy a chair.
Right. Always need to check that coverage, and usually starting with your doctor too is a good idea.
Absolutely. Because if she doesn't say it's necessary, insurance is not going to pay for it. Then you might look online on one of the marketplace, like Facebook Marketplace or your local newspaper, people do sell those chairs.
Yes. And as a Sam's Club member, I see them very often. So there are ways to get them outside of insurance as well. But you just kind of have to compare those costs and what works best for you. Well, we've have a good morning from Porter County from Miss Wendy Masters. So thanks for being on, Wendy. And I was gonna kind of ask a question. I had a client the other day. We were looking at a prescription drug plan for them. They are actually on extra help, so they qualify for quarterly changes to their plans. And so this was last week, so we were still in March, and the reason that they wanted to change is because one of their medicines was a pretty high cost. I think it was costing them around $200, and they're on extra help. So, we know that with the extra help coverage, that cap would be no more than $10.35. So, ladies, can you explain to our audience kind of what a client on extra help needs to make sure, and just, making sure that their medications are going to be covered, and just kind of explaining how extra help works with the drug plans?
Susan, I'll let you have that one.
Okay, well, sometimes that occurrence will send people into a panic. I know it would make me very upset and anxious. And that's what drives people to ship, because they'll call and say, oh my gosh, they're charging me $200 and I don't have $200 for this medicine. And so then we're able to ask a few more questions. And like Melanie said, if folks receive extra help benefits, that allows them to make quarterly changes to their Part D plan. But here's the deal. Not every Part D plan covers every medicine. So you have to, whether you're getting a new medicine or it's at the general time for you to review plans for the upcoming year, you have to make sure the plan you select covers your medicines, because you may have a medicine that plan doesn't cover, but if you just switch plans, it'll cover all of them. And of course, that information is all on that plan finder, which is on the Medicare.gov website. And that's what SHIP counselors, use to help people review options. And there's a lot of information on that plan finder tool, but there is an indicator that it says, 2 out of 2 medicines are covered, 3 out of 3, 10 out of 10, or they might say, 9 out of 13 medicines are covered. And so then you need to perk your ears up and check those medicines that aren't covered and how much that's going to cost you, because it is possible that there's another plan that covers them all. Now, the follow-up question to that is, what if I'm on a plan and it's at the beginning of my quarter and I'm on extra help, so I don't have tons of money laying around, and I get prescribed a new medication that's not on my Part D plan, and I've already made my one change for this quarter. Do I have to wait 3 months to be able to change again to get that drug covered? Well, yes. However, let's toss around some ideas that might be good resources for folks who fall into that area. Melanie and Megan, what would you tell your client if you had a situation like that? What are some options to getting medicines that aren't on your plan, but you're not allowed to change?
Well, the first two things that would come to my mind is GoodRx. So the assistance program where you can go to the pharmacy and say, hey, can you run this through GoodRx and see how much it comes up? The other would be looking into a manufacturer program for that drug and seeing if you can apply for the manufacturer to either pay for the drug completely or to discount the price.
Yes, absolutely. And I always kind of like what I said before is talk to your doctor. They may be able to write what's called a formulary exception to your plan. Or you may be able to bring I always tell clients when they get their formulary list, a list of the covered medicines from their plan, that they can bring that to their doctor's appointments, especially when you may be experiencing new symptoms or potentially being diagnosed with something new that needs treatment, it's always good to bring that to your doctor's office because, there may be more than one medicine that you can take for different conditions or for the same condition, I should say. So it's always good to, always work with them because I think when you show them what's covered and what your situation is, and sometimes they have samples so you can get a hold of
Mhm.
those samples too. But yes, and that's just as Susan and Megan said, there's always, there's several ways to look into things. And that's what I love about the SHIP counseling program is all of our counselors are really there to help. And so if we have any ideas or any experiences that we've had, we always share that with our clients because we want you guys to have the best outcome and really best access to your healthcare needs. So,
Right. Those are great
absolutely.
ideas, gals. Thanks.
All right. Well, I don't see any questions coming on oh, I do. Wendy Masters just got one on here. I was refused a medicine on my plan and I need this medicine. I wrote an appeal letter and was permitted a price adjustment. So, Wendy, great job. Way to advocate for
Mhm.
yourself. And that's always an option as well. I've even sat with clients and called drug plans as well. And sometimes they work with you. You just
Mhm.
never know. But the worst case scenario is you just get a no. There's nothing wrong with
Mhm.
trying. So thanks for sharing that, Wendy.
Yeah. Great job, Wendy.
Yes. All right, ladies, do you guys have any questions that have come into you directly?
Well, I haven't. But when you ask Megan, what's a very common question that she's asked? I got to throw in mine.
Oh, yes, I should have asked you as well. I'm glad.
Mine, people ask me, and maybe it's because a lot of my friends are turning 65, but they say, do I have to sign up for Medicare? Or they say, I got to talk to you about my Medicare. I got to sign up. I'm turning 65 this year. And so that question is always, it depends.
Let's
Uh,
do a true false game here, real quick,
oh,
Susan.
I love a game.
Okay. True or false? You have to sign up for Medicare when you turn 65.
False for most people, for a lot of people, but it depends.
Well, tell us why. Why can that be false? And why can that be true?
Okay, well, people who do not need to sign up for Medicare are folks who are actively working for a large employer and they get their credible insurance coverage, both health and drugs, through that large employer. Or they're covered as a spouse or a dependent under an actively working person's large employer group plan. So those people, as I say, can kick the Medicare can down the road if they want to. Also, people who, need to really consider signing up for Medicare are those folks who are contributing to an HSA, a healthcare
Mhm.
savings account. So the IRS, our friend this month, they say that you are not allowed to contribute to an HSA if you're receiving any part of Medicare. So sometimes you got to pick yes or no. So those are a couple of instances where folks might not want to sign up for Medicare. The other, you might want to sign up for Medicare if your employer group plan is expensive and it's maybe got a super duper high deductible or something like that. And Medicare turns out to be a better financial deal for you and better coverage. So the key there is to compare what your large employer group plan offers and how much it costs, and what Medicare covers and how much it costs. And then you decide what you want to do from there. Medicare is there for you as long as you've worked your 40 quarters and chipped into the pot. It's ready for you at age 65 if you're aging
Yes.
into Medicare. Another reason why you would probably want to get on Medicare is if you worked for a small employer. And if you're 65 or over, that means 20 people or less of employees, or for a company who doesn't have insurance benefits at all, or the insurance benefits they have are not credible. And credible or creditable coverage just means as good or better than Medicare. And folks who do your HR, your benefits, they'll know if they offer credible coverage or not. So that question is always it depends. But whether I'm working at a health fair or whether I'm answering the 800 calls, I get that question all the time. And that's when you just have to ask some follow-up questions to clarify the situation before you say yes or no.
You know, that's one of the reasons that we started these new to Medicare webinars. So our new to Medicare webinars, I don't have the date right on me, but I know it's coming up in May.
I'll
But
check.
I know we're doing these quarterly, and we do these in the evening because we know that some folks are working and they're not available at 10 a.m. So we started these at 5:30. You got that date, Megan?
Yes, it is May the 18th.
May the 18th. So we'll be doing our next new to Medicare webinar, and our promotions for that and registrations will be up in the next couple weeks or so.
And that's
So
5:30 Melanie time down there in
Mm.
Central Time Zone. And it's 6:30 for most of Hoosiers who are on
Oh.
Eastern Time.
good catch there. Good catch there.
I mean, you can join us at 5:30. I'll just be hanging out looking at a blank screen for an hour.
That is true. That is true. Okay, so true or false, I have to turn in a form no matter what when I turn 65. Like if I'm going to not take Medicare, or if I am going to take Medicare, I got to turn in a form or let them know something.
False.
False. So when do you, if you are delaying your Medicare because you're working, you don't have to do anything until you're ready for Medicare, right? So there's 2 forms that you would fill out to apply for your Medicare. And those are available on the Social Security's website. SHIP counselors, we have those in our toolboxes as well. And your employers usually work with you on that too. So, but there's nothing you have to do except for celebrate that 65th birthday. You don't have to contact Social Security.
Right.
Okay,
And
Megan, true or false?
Okay.
I don't need to take Medicare because I'm on retiree coverage.
That's a depends. That's a depends. It's probably going to be true in a lot of circumstances, but it depends on if the retiree coverage is what you want for your insurance. I mean, if it's covering everything, and if it doesn't have a high deductible, you know, if it has the copays are reasonable. I mean, that's really when you want to come meet with a SHIP counselor and compare the two, just like Susan was saying with the employer insurance. If it's covering things perfectly fine, how you want it to, it's better than Medicare, then go ahead and keep it. But if it's not, then you could move to Medicare.
Right.
And
And
they can work
sometimes,
together. Yeah, go ahead, Susan.
right. And sometimes retiree plans require you to get Medicare A and B.
True.
And then the retirement option kind of supplements A and B. And that could be all different kinds of ways. It just depends on what your employer has for their retirees. And we have seen, and it's just a heartbreaker as a counselor, folks who come to us because their companies, you know, 10 years ago when they retired, promised them lifetime benefits. And then the companies now are not. And so they come to us not knowing anything about Medicare or insurance because their companies just gave them what they had.
Yep.
So we're always happy to help those people and give them a little extra encouragement and support as they start navigating that for the first time. But
Absolutely.
a lot of the questions about Medicare are, it depends.
Yes, that's why we exist.
Mhm.
That's why we exist. Okay, girls. Well, we got a couple questions that came into the chat here. Sean comes back up to us. Hi, Sean. What options do folks have if they have not worked 40 quarters and are turning 65? Well, I'm going to start this one out. It depends. But I haven't taken one lately, girls, so I'll take this one. If someone is turning 65 and is that eligible age for Medicare, but they have not paid into the system or have not paid into their taxes enough with those 40 quarters, they would have a premium for that Part A. So these folks are not automatically enrolled, even if they are on Social Security benefits. And these folks, if they do not take Part A when they're first eligible, they may see penalties down the road. But if they have another type of insurance, they can use that insurance as well. So the options normally as a SHIP counselor, the first thing that I pull out of my toolbox is the Medicare Savings Program limits. So I usually go over any Medicare savings programs that they may qualify for, or if they're currently on the Healthy Indiana plan, or if they're currently on another form of Medicaid, we usually can help them. We can see if they meet the qualifications for the Medicare Savings Program or for Medicaid, and then we can help them coordinate that with their Medicare. So one of the options is those folks that are on Medicaid or Medicaid QMB, the state will actually pay that Part A and Part B, for that matter, premiums. So that can actually allow them to enroll in Medicare premium free when they otherwise wouldn't have been able to. But that can be a tricky situation, and that's sometimes why folks don't have Part A, is because it can be a pretty hefty premium amount. I know if it's less than 30 quarters, I have that one memorized. It's like a $505 a month premium, which is quite hefty for any type of insurance. So, but yes, we sit down with them and we explain why, that happened. I recently had a client, they were turning 65, but they were still currently working, and they didn't have those full credits yet, but they will once, as long as they can continue to work once they do plan to retire. So, you do have past that 65th birthday, to continue to earn credits as well. Ladies?
Yes, I have something. The other thing I look at is if I have a client call and they say, well, I don't have enough credits, so I've got to pay for the Part A, I can't afford it, is I find out if they're married or not. Because if their spouse, in some cases, if their spouse has their credits in, then the spouse that doesn't have credits in can draw off of the spouse that does have credits and get some Social Security benefits and Medicare without having to pay for Part A. So I would work out that scenario with those clients.
Oh yes, that's a good thought. Absolutely. All right. Okay, well, Monica Griffin is on. Good morning, Monica. My sister is on Medicare. She has a Medigap with a premium of about $200 per month. Her Part B premium, which is $164.90, and then her Part D premium, which is $30 a month, with a deductible $505. That's costing her a lot of money. She's considering going to an Advantage plan. What are some things for her to look at?
Well, thanks for the question, Monica. And we're happy to talk to your sister one-on-one as well. But I think probably a lot of people are feeling the crunch of rising insurance rates. And, that's a lot of money But she probably has a G or an F plan. And that is, well, I used to call it Cadillac coverage, but I think I need to move that to something like, Maserati coverage or something that people,
Tesla coverage.
well, yeah, maybe. But so pretty much with all of that coverage, the things that she pays out of pocket for are perhaps the Part B annual deductible, which is $226 this year, and then the cost of her drugs. And then all of her medical care after that deductible would be covered by Medicare and that supplement plan. So it might be a lot per month, but if she's consuming medical care, if she averages that out, it might not be that much. And that is critical when you're comparing supplements to Advantage plans. So we know that most people can change to an Advantage plan during open enrollment for it to be effective on January 1st of the following year. That's part of that whole open enrollment thing that happens between October and December every year. But people have to understand about how Advantage plans work and look past the monthly premium.
Mhm.
So if you look at plans and there's zero monthly premium, maybe even zero deductible for health and drugs, people are like, oh my gosh, this is terrific. I'm getting this plan. It's so much cheaper. But then if they're, pretty healthy users of medical care, once you start adding up the out-of-pocket costs, it may just be cheaper overall to stick with the supplement plan. But it just depends. And like I always say, the thing that people need to consider always for all insurance decisions is how they tolerate risk. Are they a person who doesn't want to spend much per month, understanding that as they go along, there's going to be out-of-pocket costs? Those people assume a little bit more risk. Or are they folks who say, you know what, I'd just rather pay more a month and not have to worry about, do I have the money to pay for those costs as I go along? And those people are a little less risk takers and might be better served by a supplement plan if they feel that's the way they want to go. There's also some issues around switching back and forth from GAP plans to Advantage plans. For a lot of people, you just can't do that whenever the heck you want, because if that was allowed, people would get Advantage plans. And then once they got some hefty price tag of a diagnosis, they'd want to switch right over to a supplement or a Medigap plan. And that's really not how insurance works. It's kind of trying to buy a car insurance after you've had the wreck. So, Monica, I would say your sister needs to really understand how Advantage plans work, including networks and deductibles and copays and coinsurance, and then compare that to the coverage that she's getting through her GAP plan. And I'll just give you one quick example. I was working with a new to Medicare woman, and she was going through cancer treatments. And she was moving from the Healthy Indiana plan to Medicare. So she didn't have loads of income, nor resources for this situation. And so she pretty much came in saying, well, I know the only thing I can afford is those Advantage plans. So let's look at those. So we looked at Advantage plans. We found some that had all of her providers in their network. And so she was pretty happy with that. But she was getting regular chemo treatments, coming up on radiation, and she was having some infusions in addition to those in the office. And so I just said, let's consider supplement plans, because when she's new to Medicare, they don't look at her medical condition. And we did the math. So her supplement plan was around $100 a month, but that was less than half the price of her maximum out of pocket on those Advantage plans. So it was cheaper for her to pay more a month and no out of pocket than it was for her to have an Advantage plan. And so that's where talking with a SHIP counselor can really help, because we're going to look at all sides. We don't care, what you pick. We have no skin in your game. We want to make sure you understand how both work. And then whatever you decide is fine with us.
great explanation. And it really does just, it takes kind of, you really have to think about it. There's no right or wrong answer. And my favorite client is, well, my neighbor has this, and this is what I want. Well, your neighbor may not have the same medical needs or the
Mhm.
same pocketbook as you do as well. So it's always good just to sit down and let us give you things to consider and explain the options. Okay, one more true or false, and then I'll stop. If I have a Medicare Advantage plan, I do not have to pay my Part B premium.
False.
False. You guys nailed that one. Well, believe it or not, that's a question we get a lot. So
Mhm.
just understand that Advantage plan is still another policy in addition to your Medicare Part A and Part B. So even though they're managing your benefits, Social Security still would like you to pay that Part B premium. So, okay, girls. Well, I don't see any other questions coming in. I just have, unless you guys have more, I just have one more question, and that's what's coming up the rest of this month. Megan, I'm going to let you tell us what we've got here. I'll get the
Perfect.
calendar pulled up for you.
I can do that. We have a great lineup here in April. So next Wednesday, we will not be here next week on Monday, but we'll be here next Wednesday. Well, I won't be on, but Susan and Melanie will be here. So Susan is going to take a field trip down the road from her house, and she's going to the Indiana Ship Office, and she is going to introduce everyone to the call center, to the lovely folks that take the 1-800 calls and help you when you have questions. So you're going to be able to see the office. You're going to learn about what happens when you call the call center, the phone services, and meet some of the people in the call center. And then on April the 24th, we are going to talk about scams. We're going to do a Medicare scam report. And we have our friends from the Indiana Senior Medicare Patrol that are going to be on and talk to us about some of the most popular scams out there right now. So we have a wonderful lineup for the rest of April.
Thanks for that rundown, Megan. And I would just throw this out here. If there's a topic that you would like for us to cover on our Medicare Mondays or What to Know Wednesdays, just shoot us an email or just put a note on our Facebook page. We actively monitor our Facebook page. So a lot of times people will pose a question and then one of us will respond with the Facebook. So let us know what you want us to cover, and we're happy to do it.
Absolutely. And with that, we wish you a wonderful week and happy Medicare Monday. Thanks for tuning in. Bye-bye.
Bye.